All right. It is my pleasure to introduce our first presenter. Dr. Chris Zaletsky has traveled to us from Omaha. Chris is a strong supporter of what pharmacy technicians do with the pharmacy technicians he works with at his pharmacy, as well as with pharmacy technicians learning. He will help with patient interviewing kind of scenarios with our pharmacy technician students. That's what his topic is about. In doing that, I think he's really able to see the strengths of the pharmacy technicians with patient interviewing, as well as kind of help all of us through the weaknesses to be better. So please help me in welcoming our first presenter, Dr. Zaletsky.
Thank you, Judy. Can you guys hear me okay? Perfect. So like Judy said, my name is Chris, and I am a pharmacist at Nebraska Medicine's retail/specialty pharmacy in Omaha. I basically serve two roles within the pharmacy. My primary responsibility is that of technician supervisor, so I do lead a team of about 35 technicians. Everything from onboarding, training, continuing education, really just overseeing the day-to-day stuff that happens in the pharmacy. And then second to that, we're actually opening up a brand new pharmacy here in about 3 to 4 weeks. And so standing that up from the ground up has been certainly a learning experience for me, but definitely my primary responsibility is working with our technicians. So like Judy mentioned, one of the other things that I do with her is patient interviews. So when Judy is finishing up her certification courses for technicians who are going through the class, one thing they do is a skills assessment. And so what I do is I work with the technicians. We coordinate a patient interview where they come into an exam room. They have a mock patient who has a medication list. They go through a series of questions, really with the purpose of gathering that medication history, and asking all the right questions to get as much information from the patient as they can so that they can take that back to the pharmacist and create a good care plan for the patient, because that's overall what our goal is. So what we do is, the technician will come in, they'll give the interview. Once all is said and done, we'll sit and go through it. We'll give a recap of everything that was discussed during the interview. We'll take a look at, what they did well, what maybe were some areas of improvement. We go through all kinds of different things and really just try to make it so that we can get to a clean, concise, and comprehensive interview all around. So with that, we'll go ahead and get started. So throughout the presentation, we'll go through a lot of those tips and tricks, things that we want to make sure that we're remembering each time we're talking with a patient. Now, this will be geared a lot towards, like medication histories, doing those medication reconciliations. But a lot of these tips and tricks are things that we can use every day in our pharmacies. If we're up at our point of sale, we're interacting with a patient, selling a medication, or we're talking to them on the phone. These are just some really easy tips and tricks and things to kind of keep in the back of your mind each time you're talking with someone. So some objectives here. So we're going to discuss, describe, and summarize. So we'll discuss the purpose of the interview. What are the goals? Really, what are we trying to get? What information do we want the patient to give us? As far as describing, so we're going to describe some techniques, some of the basic components of the interview, things like your pace, your volume, your tone, all that type of stuff. And then summarize, we're basically going to put all the pieces together and what can we do to have a good comprehensive patient interview. So before we start jumping into some of those objectives, I wanted to highlight this little excerpt that I found when I was doing some research for this presentation. And to me, this is kind of a really great summary of what all the interview is about and how to start really building that trusting relationship with your patient. Because overall, that's our goal. And so I'll read through this quickly. So active listening and communicating to patients conveys respect for their self-knowledge, and it builds trust. It allows pharmacy technicians to assume the role of the trusted intermediary, and it's only through shared knowledge that the pharmacy team and patients can co-create an authentic, viable care plan. So to me, that's pretty powerful, is that does, summarize everything that we're trying to do when we're communicating with our patients. So looking at that first sentence there, active listening, that's something that we're going to dive into here in some subsequent slides. But if really talking with a patient and communicating with them is a two-way street. Like, we all know the right questions to ask. We know what information we want to get from the patient. But taking a step back to sit and listen to them. Devote your full attention to them. Let them know that you're here to listen, you're here to digest what they're saying, and you want to comprehend what they're saying, because that's what really, that's what truly starts to build that trusting relationship. We heard a couple times in some of the presentations yesterday that pharmacy is the most trusted, healthcare profession out there, and it's through interactions like this that we can start to really build those relationships with our patients. And then I love the second sentence here. It allows the pharmacy technician to assume the role of the trusted intermediary. Again, back to some of the things that we were talking about yesterday. The technicians, you're the ones on the front lines. You're the ones who are working with the patients every day, whether it be at the point of sale or in the exam room or in the hospital room, wherever. Like, you guys are the ones right on the front lines there. And so being able to communicate effectively with your patients and gain the information that's needed, that puts you in a position to be that trusted intermediary. You're the one that we, as a pharmacist, I rely on a technician to get me the information that I need, and that way we can work together to come up with a good plan for our patients. So, and then we'll touch on a couple of these other things here in some of these other slides. So let's get into just the purpose and the goals of the interview. So overall, the purpose of our interview is, like I've said a couple times already, to gather information. And in this case here, we're going to gather some information specifically about the medication history for a patient. So what this does, again, gathering this information, it allows the technicians to assist the pharmacist in providing that patient-centered care, because ultimately that's what it's all about. We want to make sure that we're helping that patient that's in front of us. We have a complete picture of their medication history so that we can move on and move forward with a good care plan for them. So along with that, we have some goals here. In this case here, we're going to review an active medication list. We're going to record accurate information for the pharmacist's review of the care plan. And again, establish that relationship with the patient. This bottom line here, this is something else that I found here while doing some research, but patient interviews are the most common evaluation tool in medicine. And that spans the whole gamut of medicine, not just pharmacy. But you can really start to kind of get a sense of how important communication is. Judy mentioned it yesterday in her presentation that communication is essential in all aspects of pharmacy and medicine, everything. And I think just being able to really communicate with your patient is going to go a long way in giving them the proper care that they need. So we'll start to go through some techniques here. We'll take a look at some verbal qualities, some nonverbal cues, asking the right questions. That's something that comes up a lot is, what questions do we ask a patient? How do we ask the right questions? And what can we do to keep our patients engaged? So looking at some of these verbal qualities here, so we have a few things up top. So we have pace, tone, and volume. All three of these things are going to be really important just to kind of set the stage for what the interview should be. So our pace, speaking at an appropriate speed. Making sure you're not speaking too quickly so that the patient doesn't understand what you're saying, but making sure that you're not speaking too slowly as to disengage them. The tone. The way in which the patient's spoken to. We want to make sure that we are speaking to them in a professional manner. We're not, yelling at them. We're not talking too softly. All that type of stuff. And then our volume. Volume is really important because we want to make sure that we're speaking at an appropriate volume, obviously for the patient to hear us. But second, make sure that we're safeguarding our patient information. It's pharmacy's busy. We all work in pharmacies. We know how it can be. Limiting those distractions, making sure that we're not, our attention's not elsewhere. It's devoted right to the patient. Avoiding medical jargon, all those really technical terms. A lot of times our patients don't understand a lot of the big medical terms. The big things that I see, commonly, and we'll see a couple examples here soon, but abbreviations of medications. Using, APAP, ASA, like, does a patient know what ASA is? Probably not. I mean, I guess I'll pose the question to the audience here. Who knows what ASA is? Exactly. So you guys all know that. A patient may not know that. ASA is acetylsalicylic acid. That's something that we all learned, we all know, but the patient's not going to know that. So if we tell them, how are you taking your ASA 81 milligrams, they're going to kind of look at you, weird. They're not going to know what you're talking about. So just making sure to avoid those technical terms. Maintaining a degree of professionalism. We want to make sure that we're speaking to them, in a way that, it portrays a good conversation in so much that we're not degrading them. We're not, putting them down in any way. We're all on the same team, right? Us and our patients, and we want to make sure that we stick to that. And then asking the right questions. This is something that comes up often, and this is probably when I do the patient or the critiques with the technicians after we do the skills assessment. Asking the right questions tends to be the area that we focus the most on, because it's really the way in which you ask a question that's really going to drive how your interview is done. So we'll take a look here at a few examples of questions. So overall, how do you ask questions in the interview? So we have 3 different types of questions here, and really the goal behind these is to get your patient talking. We want to keep them engaged. We want to make sure that they're not just simply giving you a yes or no answer. We want them to give us the information. So 3 types of questions. First is open-ended. These are your questions that are going to elicit a good response. The opposite of this is a closed-ended question. That's something that's just going to be a yes or no answer. We'll take a look on the next slide here at some examples of that. Probing questions. These are things that are going to, you're asking the patient for more detail. You want to really dive into, why are you missing a dose? Those types of things. So probing questions and open-ended questions are really great tools in getting that information from the patient, whereas a leading question is kind of the opposite effect. So these are the ones that we want to avoid. So our leading questions, that's a question that I would ask someone where I'm expecting them to answer it a certain way, and then I'll ask the question hoping they answer it how I want them to answer. That's not going to be a great thing to do during an interview, because I want the patient to give me the true honest answer, not what I want them to think that I want to hear. So with our open-ended questions, again, these are ones that elicit or do not elicit a simple yes or no answer. So we can look at the table here. On the left side, we have some of our closed-ended questions. So do you have allergies to medications? Do you miss doses of your medications? Is your date of birth, July 23rd? Do you have any questions for the pharmacist? While these are great questions to ask, there's just a better way to ask them, because oftentimes you're going to get just a simple yes or no answer. My experience in working with patients, doing interviews, even just counseling patients, if you're asking these types of questions, a lot of times they're half paying attention. I can remember counseling someone one time as he's sitting on his phone, just texting away, I'm counseling and asking questions, and, using these closed-ended questions, it was all, yep, nope, half paying attention. Overall, was it a really good, quality interview? Probably not. And so we want to make sure, again, to keep our patients engaged. We want to keep them talking, and that way you can get the right information. So looking at the right side of the table here, it's kind of the opposite of all of these questions. So rather than do you have allergies to medications, what allergies to medications do you have? Patient can't answer that with a simple yes or no question. They have to actually talk to you. Do you miss doses of your medications? Well, when's the last time you missed a dose? Is your birthday, July 23rd? Well, what is your birthday? Make the patient tell you what their birthday is. And then finally, do you have any questions for the pharmacist? Well, what questions do you have for the pharmacist? Even if they don't have any questions and they say, no, I don't have any questions, that's your confirmation right there that they actually heard you, they understood what question you were asking, and they are paying attention and they're engaged. So here we get into some of our probing and leading questions. So again, those probing questions, those are ones that are going to ask for more detail. You're really trying to get some additional insight. So again, this really engages your patient to think about their answer, which is what we want them to do. So I go back to the question on missing a dose. So when was the last time you missed a dose? Well, let's say your patient says, well, I missed my metformin twice last week. Okay, well, what do you think causes you to miss a dose? Again, you're getting the patient involved, you're getting them talking, you're getting them to give you an actual answer rather than just saying yes or no. Leading questions, again, these are ones that prompt the patient to give you an answer that you want. So again, avoid these if possible. Oftentimes these are closed-ended questions too, so they are going to just give that simple yes or no answer. And a lot of times, again, the patient's going to answer based off of what they think you want to hear, so you may not get a full accurate answer. Some nonverbal cues, looking at things like facial expression, posture, eye contact, body language. Your facial expression, says a lot. When you ask a patient, when was the last time you missed a dose, and they said, well, I missed, the last 2 weeks of my metformin, kind of giving them one of these, doesn't really portray, a whole lot to them. It's not professional. You want to make sure that you're maintaining a good facial expression there. Posture, whether you're sitting, standing, just standing upright, focused right on the patient, facing the patient, not, looking around all over the place, just giving your full devoted attention to them. Eye contact, goes without saying, make sure you're making eye contact with your patient as you're talking with them, conveys that you're paying attention to them. And your body language. It's okay. I mean, you guys can see me, I'm moving around a lot up here. I'm a little nervous, to be honest. But your body language, that conveys a lot. You don't want to be flailing your arms around, all that. You want to just make sure you're focused right on your patient. And then active listening. We saw a little bit of active listening before. And the next slide we'll touch a bit more on that too. But really, taking the time to sit and just listen. A lot of times your patients have a lot of information they want to give you. If you're asking those right questions, they're going to give that to you. And this is what really starts to build those trusting relationships. So active listening. So we have some tips here. Again, make sure to give the patient your full undivided attention. This shows that you're sincerely interested in what they're saying. Now, this is a big thing here. Be aware of your own feelings or opinions. Going back to the same thing before, what I mentioned, patient says they missed 2 weeks worth of their metformin. For us, we want to, me as a pharmacist, I'm like, oh, you missed the last 2 weeks. Like, what are you doing? But I can't say that to a patient. I'm not going to accuse them of being a bad patient or, anything like that. I want to reserve those opinions for myself and understand that, these things happen and that we're in a position where we can take what they're saying, we can run with it and make sure that they are set up for, all the success moving forward. It's okay to, while you're listening, jot some notes down. If the patient tells you something or they ask a question, it's totally fine to jot a quick note down. It's okay to say you don't know. It's okay to say, hey, you know what, I need to take this to the pharmacist. They'll be with you as soon as we can, and they'll help you answer that question. But if it is a question that, as a technician, you're able to answer, absolutely ask those clarifying questions. Make sure, again, this is showing that your patient is engaged in you and you're engaged in them. And then after all is said and done, you have your notes, everything, make sure to restate, those key points. This shows that you understand everything that they've conveyed to you. You have the accurate information to be able to be passed on. So knowing all of this, what are the components of a patient interview? And so here we'll go through a few scenarios or different things. So, preparation, the introduction, the body, the closing of the interview, all of those things. And just a quick little note here, at any point during the interview, if ever there's a question that, elicits some sort of clinical guidance or something that's beyond the scope of a technician, jot that down. That's something that can easily be taken to the pharmacist, and we can work together to make sure that we answer the patient's questions fully. They understand, everything that they were asking. That way, when they leave the interview, they've got all the information, we have all the information, everyone's on the same page. So as far as preparation goes, first step is knowing your patient. Second step, know the purpose. We've talked about that a bit already. Third step, know your environment. We haven't really talked a whole lot about the environment yet, but we'll touch on that here in a bit. So as far as knowing your patient, so prior to the interview, take a few minutes to review the patient's profile. Pull up their chart, look up their, easy stuff, name, date of birth, allergies to medications. What is their active medication list? What are their meds? What are their doses? How frequently are they using these things? So here we got a few questions, things that we want to make sure that we know and understand before talking with our patient. So what medications does that patient take? Again, doses and frequencies, allergies. A lot of times, what does their insurance coverage look like? So I work in a retail outpatient setting. We bill all kinds of insurances. Patients are getting new medications, may require prior authorization, all these things that we love dealing with. So what does that insurance coverage look like? A lot of times we're able to help the patient, explain the process. What does a prior auth process look like? If the patient comes to me and says, hey, I have a prescription for this drug, can we look up their formulary? Can we call the insurance company? Can we, what can we do to make sure that we're setting the patient up so that they know what to expect when they actually do give us this prescription for a medication? Are they going to be able to get it right away, or are they not? And again, knowing the purpose. I've touched on this a couple of times already, but why is the interview being performed? What information is going to be gathered? So it's good to just understand that, kind of keep that in the back of your mind. And then we'll see here in a bit too, it's important to be able to pass this on to the patient as well, so they know what to expect too. And then finally, knowing your environment. So make sure the environment surrounding the interview, is free of distractions, because this is just as important as the actual interview itself. So you want to obviously conduct it in a private area. What if your patient isn't in front of you? With COVID and everything, we've tried to limit patient interactions as much as possible for our safety. So a lot of these things are done over the phone. So if you're talking to someone on the phone, just make sure conversation is as private as it can be. Make sure your area is quiet so that you can dedicate the full attention to your patient, and then ensure that it's free from distractions. And I put here, phones ringing, other patients or colleagues, and I find this interesting because the pharmacy that I work at is very busy. We have 50 plus people between technicians, interns, and pharmacists. We answer 400 phone calls a day. Chris, you're one of the technicians there. You can vouch for it, right? Yeah, it's busy, and it's tough to be able to, if I were to do an interview, it would be tough. I'll be honest, because there's, the second you walk into the pharmacy until the second you leave, all you hear is the phone ringing. We're fortunate we have some consultation rooms. It's easy to bring a patient in there. We can do our interview there, but a lot of times we just want to make sure that we're doing everything we can to, kind of separate us from those distractions and make sure that we're devoting our full attention to the patient. So looking at the introduction here, so again, a few things here. So obviously we want to introduce ourselves. Give a brief intro. I'll touch on an example here in a second. And then verifying your patient information. This is super important. For obvious reasons, we want to make sure the right patient is in front of us. So always verifying at least 2 patient identifiers. And we'll go through that here in a bit. But you'd be surprised with the amount of interviews that I've gone through and critiqued how often this is something that's forgotten. I don't know if it's nerves or what, or we just assume that we have the right patient in front of us, but that's something that we shouldn't assume that you have the right patient there. You want to always make sure you're verifying, even if you know the patient. There's a lot of times where I'll be at the front counter in our pharmacy and a patient will walk in and I recognize them, I know them. Still important to be able to verify that name and date of birth. And then finally, explaining the purpose of the interview again. And this is, you're explaining it. We've touched on this already. We know what we're doing with the interview. We know the purpose. What does the patient know, though? They may know that they're coming in for an interview, but why? So we want to make sure to explain that to them. So first, with the introduction, this is what sets the overall tone for the interview. It's your first opportunity to really start to gain that patient's trust. It makes them feel comfortable. It can be as simple as a conversation. So you want to make sure to introduce yourself, state your title. So I put my name up here. So hello, my name is Chris Lesky. I'm a certified pharmacy technician. Thank you for taking the time to meet with me today. It can be something as simple as that. Nice, easy, straight to the point. Lets your patient know who you are and just thank them for being there. They're taking time out of their day to come meet with you. And then verifying patient information. Again, critical to verify at least a couple patient identifiers. This makes sure you have the right person sitting in front of you. If you are doing an in-person interview, much easier, obviously, to know who is in front of you, but again, still want to verify that. But what about phone interviews? You may not have any idea who's on the other line. It could be on speakerphone. You could have other people in the room. I've done interviews before where, I've called, I've verified the patient's name and birthday. Well, turns out I'm on speaker and there's 4 other people in the room. We want to make sure we're talking to only the patient, because obviously the information shared during these interviews are things that we want to safeguard. That's a private conversation between us and the patient. So some examples of patient identifiers, obviously full name, birthday, address, phone number, medical record number. Guarantee 99% of your patients don't know what their medical record number is. I have one. I have no clue what it is. But it's just something, working in an outpatient setting, it's just another identifier that we have at our disposal. Moving on then to explaining the purpose. Again, why is the interview being conducted? I put here, the patient may already know the purpose of the interview. They may know that they're coming in for an MTM session. They know that they're going to get interviewed, and they're going to give you their medication history. How is that information going to be used? A lot of times they don't know that. We're working to try and make sure that there's no gaps in their care plan. They have all the medications necessary to treat whatever disease state they may have. They oftentimes don't know that. So if we convey that information to them, that again just makes them feel a little bit more comfortable, and again sets the tone for the rest of the interview. So here's a good example of just a comprehensive introduction. So hello, my name is Chris Zaleski, and I'm a pharmacy technician with Nebraska Medicine. Before beginning the interview, please verify your name and date of birth. I know that's not a question, but again, we're getting the patient talking. So then today I'll be conducting an interview to gather information regarding your current medication use, and this information will help the pharmacist in making decisions about your care plan. So we introduced ourselves, we said our name, we said our title, we verified that we had the right person in front of us, and we explained the purpose of the interview and how the information is going to be gathered. This takes us to our next bit of the interview, so the body. This is kind of the meat and the potatoes, I guess. What information are we going to gather? So we're going to review that with the patient. We're going to get their current prescription medication use, and then equally as important, we're going to grab the over-the-counter and herbal medication use. From my experience, a lot of times when patients are giving you their prescription medication history, they leave out the ibuprofens, the Tylenols, the eye drops, those types of things that they may use, whether they're using it on a regular basis or not, especially the herbals, which we'll talk about here in just a bit. So with regard to what information are we actually trying to get from the patient, obviously our drug allergies. The way that I look at these things is, or I guess this section, is I kind of work from the top down. So I look at the really big picture. So what is the patient's, what are they allergic to overall? This has nothing to do with their current medication list. But then we start at the top and then we slowly drill our way down. So we'll start with the allergies. Then we'll take a look at their current medications. I have a med list in front of me. We encourage patients to bring their med list in as well. Again, I'm not going to ask, are you taking metformin? I'm going to say, what prescription medications are you taking? That, again, it's going to get the patient talking. They're going to go through their list. You have the list in front of you as well. That way you can compare back and forth. If for some reason they leave a medication out, let's say they're not on lisinopril anymore, I can ask a question of, I have on my medication list that you have lisinopril. Tell me a bit more about that. You didn't list that one on there. So tell me a bit more about that. When was the last time you took that? All these types of things. Whether they're on it or not, they'll let you know. Over the counters, again, things like your Tylenols, ibuprofens, like you guys, we were here for the over the counter presentation yesterday, so we should all be familiar with those. But a lot of times, again, patients don't often consider those to be something on their medication list. But to get the full comprehensive picture, we want to make sure that we're going through those. Herbal medications, these are becoming more and more popular. A lot of the herbals have a lot of drug interactions. They're not completely studied. There's not a whole lot of evidence to support a lot of their use. And so using these things with a prescription medication, that's something that I want to know. I want to be able to go and look these things up if I don't know. Make sure that there are no drug interactions. Make sure that whatever the patient is taking is absolutely safe and is going to be effective for them. And then again, rounding it out with any questions for the pharmacist. So looking at our current prescription use, so what medications is the patient currently taking? With regard to that, we want to make sure to review the medication names. We want to review the dosing, and we want to review their usage. How frequently are they using it? Side effects. A lot of times patients, especially if they start a new medication, we all know there can be potential side effects. So asking a question of what side effects have you seen from taking this medication? If they aren't seeing any side effects, well, they'll let you know, hey, I'm not seeing any side effects. Great. We didn't ask a yes or no question there. We got them actually talking. Missed doses, we've talked about that already a bit. Avoiding your drug abbreviations. Here's where you see the ASA and the AAPT. And then again, remember to ask those open-ended questions. Over the counters and herbals, again, we talked about this a bit already, so I'll kind of go through this quickly, but what else are they taking that may not be prescription? And again, just to highlight that bottom bullet point here, many of these over-the-counters, herbals, they cause a lot of, drug interactions, can cause some unwanted side effects, all that stuff. And then with the closing, so again, we want to summarize some critical points, review any questions that the patient may have for the pharmacist, and then equally as important, what are next steps? What are we going to do with this information, and what can the patient expect as an outcome from the interview? So summarizing your critical points here, so making sure that you understand all the information that was given to you. You are able to record accurate information. This is also your chance to clarify anything. If you did jot a quick note down, you had a question or something that you wanted to ask the patient with regard to one of their medications, this is your chance to do that. And again, delivering that accurate information, of course, this is what we want. As a pharmacy team, we want to make sure that we have all the right information for our patient. So then reviewing your outstanding questions, what questions do you have for the pharmacist? Again, jotting those notes down, bringing it to the pharmacist so that we can answer all the questions that the patient may have. And then finally, next steps. So once the interview is complete, what happens next? So after you summarize your critical points, make sure you let your patient know you're going to follow up with the pharmacist. They're going to look at your notes. They're going to look at the questions that you asked. They're going to have any follow-up questions potentially. They're going to reach out to the patient. They'll be the ones that will do any of that extra outreach. If the pharmacist is unavailable or if they're planning to meet the patient at a later time, it's important to get some good contact information. Make sure that you're getting good phone numbers, all that type of stuff so the pharmacist can reach out to the patient if needed. And then, of course, we want to always thank our patient for their time. Again, these interviews shouldn't last anything more than, 15, 20 minutes, but, it's time out of the patient's day. They're coming to you, for our services. So we want to make sure to thank them for their time and all the information shared. So finally, putting the pieces together, how is the perfect interview performed? So this is where we're going to kind of summarize everything that we talked about, all the good questions, all of that, getting our preparation, our introduction, our body and our closing, all of that stuff down so that we can, deliver a good comprehensive interview. Make sure to actively listen to your patient, just as important as asking questions. Always remember the overall purpose and the goals of the interview. And then always remember to summarize those critical points and make sure that we have accurate information to give to the pharmacist. A really busy slide here, but summarizing some of the do's and don'ts. So left side of the column here, these are things that we want to make sure that we do. And again, on the right side here, things that we make sure to not do. I'll just pick a couple of these here. So obviously you want to properly prepare for the interview. Don't show up unprepared, unorganized, all of that. Remember the preparation, that's step one in getting everything down for the interview. Verifying your patient identifiers, using your appropriate nonverbal cues. All of these things are so important in making sure that we have a good comprehensive interview. And then, of course, some of the things that we don't want to do. Obviously, we don't want to assume we have all the information without reviewing it with our patient. Don't ever assume that they don't have questions. A lot of times patients do have questions, they just don't know how to ask them. And so this is our opportunity here to make sure that we're getting them engaged again and talking through everything with them. And that being said, that brings me to the end. So I will open it up for any questions. Yes.
Do you have the technicians enter the information that they've got from the patient into a computer system?
So the question was, do I have the technicians enter a lot of the information that they gather from patients into our pharmacy system? Short answer, yes. In our pharmacy here, we do some patient interviews, prepping for like MTMs and stuff like that, and we have certain documentation and things that we put in. We're fortunate enough that we have our pharmacy software. We also have the electronic health record that ties into the inpatient chart and everything too. So we can document everything right in there. We try to be as diligent as possible with all of our notes and everything. Yeah.
The patients do the techs run into a lot of medications that the patients are no longer using or are incorrect on the list?
So the question was, do the technicians run into a lot of times where patients have medications they may not be using any longer? Again, we're fortunate that we have the charting system. So when I go through a patient's profile, ours matches what's on the inpatient side. Or what they see in the chart. So for us, it's pretty accurate. Now, patients may come in and they may have 3 or 4 other medications listed on their list that they took a few months ago that they're no longer taking. What we like to do is a comprehensive profile review and just make sure that what we have in our system matches what's in the chart, which then in turn will match what the patient has. And I've gone as far as a patient will have 15 medications on their list. Well, the chart only shows 8, and so we'll go through some of the reasons why they may have additional ones on there. We'll just type up a new medication list for them and just print it out and give it to them so they have another or more accurate list. Yes. Oh. Mm-hmm.
They don't know if they should go with a family doctor or a hospital. So sometimes we have to verify which is the right one that they are on
Mm-hmm.
to go with that one. And another thing, a lot of times the patient have one birthday and the insurance has another birthday. So that's why and the names, sometimes we say middle name, sometimes we say the first name. You're right, you have to verify. Thank you.
Yeah, absolutely. And to your point there too, when someone's going into the hospital, a lot of times, their medication list changes, when they get admitted. At our hospital, obviously we have our formulary. Patient may be on, 5 different medications. None of them are on formulary. They come into the hospital, they're immediately switched to 5 different medications. Sometimes we see upon discharge, patient sticks on the medication that they were switched to in the hospital. We go in and explain, we have a meds to beds program where we deliver medications up to the patient's room, and we do a lot of education before the patient leaves. And we go over, if there is a change, why was there a change to the new medication? Was it an oversight? Did we switch them to a formulary med while they were admitted and then just continue it and discontinue their home med? Well, what if the patient just picked up, a full stock of their home med? Now they have these meds just kind of hanging out, sitting there. So we do like to go through all of that information and try and make it as easy as possible for them, because the simpler it can be for the patient, the better it will be. So, yeah.
in medication reconciliation in the hospital. And I like doing that.
Yeah.
It was one of my favorite jobs. However, what they did at our hospital is they broke medication reconciliation into its own department. So you could post and only do medication reconciliation. And I stepped away because I was like, they're going to be expecting you to do 30. And if you don't do 30, it doesn't matter. Your medicine reconciliations can be 100% accurate every single time. But if you don't meet that metric, you're treated as though you're not doing your job. You're treated as though you are lesser. And is that what other people experience?
Absolutely.
And so there's an incredible pressure that not to excel in your position, but just to secure your position, that you're going to have to meet this metric.
The
So I
metrics
walked
are
away.
funding.
And that was a job where I felt that if I interviewed the patient, that the patient was lucky I was there because I was going to do the best I could for that patient. And if they told me they had a concern, it was going to be documented. But there is such incredible pressure to meet this number. You can meet the number if all the patients have only 3 medications.
Sure.
They know what they're taking. Or they walk in with a list from their pharmacy and they can verify everything on the list. You can meet that metric in those positions. But day in and day out, there is incredible pressure to meet a number set by somebody who's probably not doing medication.
Yeah. I completely agree with everything you said there, and you know, it is a lot of pressure. You know, in our pharmacy, in an outpatient setting, admittedly, it is a bit, you know, easier to hit some of these metrics than if you're, you know, in an inpatient unit. You're running to the ED to try and get a med rec really quick, and so I can totally understand that. And you know, we do look at metrics, of course. You know, I'm a manager in our pharmacy, and so metrics are something that we have to look at. You know, ultimately too, you know, in our outpatient setting, you know, it is a business too, so we have to be able to, you know, keep our doors open. Me personally, I'm not someone that lives and dies by our numbers. You know, I would feel much better knowing that you took an extra, you know, 10, 15 minutes to take care of the patient than hit a metric. I personally don't feel that, you know, not meeting a metric is punishable. I don't think that that's right, because you could spend 10 minutes doing, you know, all kinds of interviews. You could hit your metric for the day. Did you give quality patient care? Probably not as good as you could have done if, you know, you had the freedom to actually take the time, you know, take some notes, document everything. You know, I'm a notes person. You know, like you mentioned, if you're putting all of these notes in an EHR and then someone tells you, well, the doctor's not going to read that. Who cares? You know, you're doing your job. You're doing what you can to make sure that you're taking care of the patient. And like I said before, like us as pharmacy team members, we're the most trusted ones in the healthcare profession. I want us to put those notes in there. I want it to be comprehensive. I want you to get the full picture, because that's what's going to build that relationship with the patient. You know, if you're taking the time to do that, I guarantee when that patient is discharged, they're going to remember that. They're going to remember, hey, someone actually cared. You know, someone came in, they asked me some questions, they took time to get to know me, and rather than come in, rush, hey, what meds are you on? Jot it down quick and run out the door. So I absolutely feel where you're coming from. Understand that there's pressures, but I think overall, I guess to summarize that, I think it's got to be all about the patient. You know, you have to be able to take that extra time, and if you're not hitting metrics, then I don't know. That's hire more people. I mean, that's not an easy answer to give, but I think, you know, being able to dedicate your time and your energy to your patients is more important than hitting a metric. You're welcome. And I'll stick around afterwards too if there's additional questions. If we're running short, no, we got time.
What is your take on reporting illicit drug use in the medical?
So that can be a tough one. So it's important though. It's absolutely something that should be documented because it's something that could come into play with whatever care plan we ultimately decide. It's a good counseling point for us to reiterate the importance of maybe staying off of some of these illicit drugs. One thing that I find is very difficult in an interview is asking a patient. It's easy to ask, have you ever used any illicit drugs? And the patient kind of looks at you, like yes or no, whatever. It's easy to ask an open-ended question. What I typically do is, I'll just say, hey, for completeness sake, I do need to ask, when was the last time, if ever, you've used any illicit drugs, alcohol, whatever. I like to throw that if ever in there too, because if I don't throw that in there, it's almost as though I'm being accusatory and telling the patient, well, hey, when's the last time you did this? And I absolutely don't want to do that. So I like to throw that little piece, if ever, in there too, because then I think that takes some of the pressure off of it. But as far as recording them, yeah, absolutely.
So we have two additional categories that we ask about that really go to your establishment trust. One is medical marijuana, sort of, it's not really, I don't think, in the patient's mind considered illicit. So medical marijuana, and are you taking any medications not prescribed to you? There's a lot of medications in medicine cabinets that people go to, especially leftover pain medications from someone else's surgery, or who knows what else.
Yeah.
Other things that are in the medicine cabinet left over from the thing that someone else takes because, well, it's good for her, it should be good for me, right?
Right. No, those are excellent points to bring up too, because those are things that are going to make it more comprehensive. We're getting a better picture. Exactly.
Because the laws vary from state to state, the term illicit. My doctor, I'm from Washington, and in the past 2 months, when my pain level got so high, he goes, go on and get some THC so that you can sleep. So it's not illicit because it's legal. But he's
And it's still something that, as a pharmacist, I want to know, are you using these types of things? And, I'm from Nebraska where it is illicit, where we can't, it's illegal to have anything with THC. And so, again, those are things that I want to know, whether it's, I think that the topic of medical marijuana is, something that obviously is, a lot of states have approved it for use. Nebraska, we have it.
medical marijuana, it's legal.
Right. Right. So it's, it can be a fine line depending on your state, but something worth recording if you're taking notes down for an interview or something. Yeah.
In a non-judgmental way.
Absolutely.
One time that when someone said they were taking stuff out of the medicine cabinet, sort of went into them with, oh, you shouldn't be doing that, and they're like, oh my God, do not.
Right. Again, reserve those opinions to yourself. Right.